First on News 12, one of Pfizer's top scientists tells us kids younger than 12 will most likely not be able to get vaccinated before the next school year.
News 12 Samantha Crawford joins us now outside Montefiore, Nyack with what you need to know. So Samantha, when does he think this is a possibility?
He's thinking October is a more realistic timeline here. We had the chance to speak with Pfizer's chief scientific officer of viral vaccines and ask him the questions that many of you at home have been asking right before he and his team were honored here tonight for the work they've been doing this year. Dr. Dormitzer tells us that right now they're conducting studies on younger age groups, but the timeline depends on their findings and how soon the vaccine is authorized by the FDA. He says they currently don't have efficacy data for younger kids and infants, but pointed out the vaccine appeared to be 100% effective in 12 to 17-year-old trial participants. Now again, while children have gotten sick and died from COVID, severe cases have been much more common in adults. We asked Dr. Dormitzer why he thinks that is.
We think it may be their innate immune system. So you know how when a small child gets a mosquito bite, you have this big reaction. Children have very strong immune reactions, and it may be that those reactions actually help protect them from COVID-19. We don't know for sure, but it's a reasonable thought.
You as a scientist, do you think elementary school students should be vaccinated for COVID?
You know, as a scientist, I'm going to say we're going to wait to see the data. I think there is disease in younger kids. So if the vaccine proves to be sufficiently safe, well tolerated, and effective, it's definitely something that for public health authorities to consider.
We'll have more on this exclusive interview next week right here on News 12. We'll tackle issues related to COVID, pregnancy and fertility, and when another pandemic might happen. In Nyack, Samantha Crawford, News 12.